What's up, everybody? My name is Eric. Welcome to my channel, Eric the Tutor. What's up, everybody? My name is Eric. Welcome to my channel, Eric the Tutor. Today we have another practice problem for you, working through some brachial plexus and some different clinical correlates, kind of just trying to understand how some questions might be asked on some of your quizzes. So go ahead and work through the case, and we'll talk about it in just a moment. So go ahead and try it out and pause the video. Unpause it if you think you know the answer, okay? So a 29-year-old man presents with a stab wound and can no longer raise his arm above the 90-degree horizontal plane. The patient exhibits scapular winging. Which of the following structures was most likely affected? So scapular winging happens if there's not a particular muscle that's kind of keeping it close to the thorax, right? So immediately I'm thinking of a muscle that does that, and that's going to be my serratus anterior. So my serratus anterior kind of wraps onto that medial border on the anterior side of my scapula, and it keeps it kind of close to my rib cage, right? Because the origin of that serratus anterior is coming off of ribs 1 through 8, so it's kind of fanning out this way and holding on tightly to that anterior side of the scapula. So if that muscle is affected, then that's no longer happening. It's no longer keeping it close. So then you actually will see scapular winging when you ask the patient to raise their arm, and they actually will not be able to go above 90 degrees. And that's because the serratus anterior was affected, and the serratus anterior allows for abduction of the arm above 90 degrees. So that's the lateral rotation of the scapula. Great. So if our serratus anterior is damaged, then we know that C5, C6, C7 raises your arms to heaven. So C5, C6, C7 are the roots. And I know this is my upper trunk, middle, and lower. So C5, C6, C7 roots make up the innervation that goes to my serratus anterior. So the answer to this one is going to be B. Simply that. The roots are affected. All right? It's not going to be any of the cords that's too far gone, and it's not going to be any of the trunks that we need to worry about specifically coming off of those roots. That is likely what is going on. Cool? We'll do some more videos soon as well. So go ahead and work through this one. Give it a try. Pause the video if you think you know what the answer is. And then unpause and we'll talk about it together. Cool? All right. So a 27-year-old patient presents with the inability to draw the scapula forward, and paralysis of the pectoralis minor is observed. Which of the following is likely to be true? So let's make note. So we have inability to draw my scapula forward. So what that's telling me is this is protraction. So protraction is affected. So that's this type of motion, right? So that's protraction, bringing the scapula forward. And then we have pectoralis minor being affected as well. So I know pectoralis minor does the drawing of the scapula forward, so this is kind of going hand in hand with each other. So protraction is affected because of pectoralis minor. Immediately I'm thinking it has something to do with pectoralis minor, so we have to think of the different types of innervation from pectoralis minor versus pectoralis major. So what do you guys think pectoralis minor is innervated by? So pectoralis minor is innervated just by the medial pectoral nerve. If we were dealing with the major is going to have more. It's going to have both medial pectoral nerve and the lateral pectoral nerve. So in this case, question choice A says lesion to the lateral pectoral nerve. We know that's not going to be correct because we just said that's for our pectoralis major. So it can't be that one. Fracture of the clavicle. So there's actually no origin insertion in terms of the clavicle. Different muscles that are involved with the clavicle I can think of the trapezius or the deltoid, probably some more muscles as well, but in this case we don't have to worry about that. We just need to know that the clavicle has nothing to do with our pectoralis minor. Injury to the posterior cord, well, we know that the posterior cord gives off a radial nerve and a axillary nerve. So really nothing going on there in terms of the pectoralis minor muscle, right? So we can actually cross off answer choice C and E, because I know the axillary nerve does not innervate my pectoralis minor muscle. This is going to be teres minor and the deltoid. So that leaves us with damage to the coracoid process. So that makes sense, right? Because the coracoid process is an insertion for pectoralis minor. Cool. All right, well, that's everything, guys. So hopefully that was helpful. Stay tuned for more videos. See you next time.